My name is April Little. I'm the Manager of Infection Control at United Regional, and we're going to go over some basics of infection control. So what we're going to review is the basic things that you need to know to protect yourself and other when it comes to infection and to prevent healthcare associated infections. So that's my info and contact number. You can also find contact info on the intranet, which I'll show you in a minute how to find. Objective is to understand the transmission of infection and those techniques that we use to protect against infection, as well as available resources that we have here concerning infection control, and to especially focus on infectious agents that are relative right now. So this is in a lot of educational material related to infection transmission is the mode of transmission, which if you can understand, let's see if I can use this mouse if you can understand the mode of transmission for any organism, whether it's bacterial or otherwise, then you can help prevent the spread of that infection. All of infection control material can be found on the intranet. So if you sit down at any United Regional computer and you click on Internet Explorer or Google or whatever, it will take you to, let me show you the page. It will take you to this page, and if you click on About My Work right here, it will take you to this little drop down, and here on the side you can find infection control and prevention, and if you click on that, it will take you to this page, which shows here on the right is my contact info, as well as quick links to the CDC, the Texas Department of State Health, and other helpful quick links. Also here in the center is information that you can find related to frequently asked questions, policies, of course, 2019 COVID, there's a quick link to that will take you to a site that has all of the information, most up-to-date information and policies regarding COVID. There's a lot of questions, frequent questions about isolation, patients, and guidelines, and those can be found on this page as well. There's also some patient educational material found here and below on MRSA, C. diff, and other frequent infections. So this is a question I ask in a lot of orientations. What's the #1 way to prevent infection transmission? And of course, most people know that it's hand hygiene, but it happens to be one of the areas that a lot of people will overlook or downplay as far as importance, but it's the #1 way that you can prevent the spread of any infection regardless of what it is. So that can be done here through soap and water or hand gel. Hand gel is located outside of every patient room, as well as a sink is located in every patient room. You can choose either method to do hand hygiene. The gel is faster and more preferable to a lot of people. So just make sure when you do that that you get enough to cover the surface of your hands, and you want to rub your hands, your palms together until the gel is dry, so you don't want to wipe off any excess gel. Hand with soap and water should be done for at least 15 seconds, 20 is preferable. These are the areas most commonly missed when hand hygiene is performed. So for some reason, a lot of times the areas between the thumbs are missed, as well as the fingernail area. As far as fingernails, so artificial nails or extenders are not allowed for people who work in patient care areas. Your nails should be 1/4 of an inch or less in length, and a good way for you to do that is if you take your hand and you hold it up like this. You should not be able to see fingernails above the rim of your finger, your actual finger. Nail polish is okay as long as it's not chipped or worn, and that includes shellac. So if you have gel or shellac, that's fine as well, as long as it's not chipped or worn. So it's a great excuse to tell your husband or boyfriend, hey, I have to go get my nails done. That's if they're open, so they've been shut down for a while. I'm not sure if they've actually opened up back up yet. So hand hygiene compliance is monitored by quality as well as different means to watch. So sometimes that includes video monitoring or asking people, can you do hand hygiene for me today? As well as asking the patient, did your healthcare provider perform hand hygiene today? So this is one of the famous quotes that come out of infection control. If it's wet and not yours, don't touch it and don't let it touch you. And if you do, wash your hands. So PPE has been a big topic globally for the last few weeks, for the last few months. I'm not going to read this to you because I know that you can read. But the main premise is to understand that you want to use the level of protection that matches the procedure or action that you're performing. So standard precautions used to be called universal precautions. Those precautions that we use to prevent infection universally, globally. So no matter what patient you're performing care for, you want to use these precautions. And they were based off of the Bloodborne Pathogen Act in the 1990s, the late 1980s, to prevent transmission of bloodborne pathogens such as HIV and hepatitis. So that included things like wearing gloves when you're performing an IV insertion, or wearing a gown if you're performing a procedure that would create potential splashes of body fluids. Transmission-based precautions are those that we put in addition to universal precautions to help prevent the transmission of infection for certain organisms. And they're based on guidelines from the Center for Disease Control, based on those pathogens and based on the type of infection that you're involved with. So protective isolation is the first one, and it's for patients that have some sort of compromise in their immune system. So to patients that have neutropenia, or patients that have some sort of defense mechanism that's been lowered, so it puts them at increased risk of infection. And so for these patients, we want to make sure that we're wearing a mask if we have cold or flu symptoms. Right now, every person entering the facility has to wear a cloth face mask, so that is sufficient for these patients. I would say that you don't want to go into these rooms if you have any type of cold or flu symptoms, because currently, if you have cold or flu symptoms, you're not allowed to enter anyways. As well as performing that hand hygiene that we know is so important before going in or leaving the room. Fresh fruit is not allowed in these rooms, as well as any type of plants, because there are certain organisms that can thrive in soil or on the surface of fresh fruits that can be infectious to these type of patients that have this compromised immune system. Contact precautions are the most frequently used isolation, and those are for organisms that have been shown through research to spread through contact. So MRSA is a good example of that, as well as VRE and C. diff. Contact precautions has this sign before you enter it that shows you that you need to perform hand hygiene, as well as have a gown and gloves before you go into the room. And then you have this before you go into the room, and then you want to remove the gown and the gloves before you leave the room. And then, of course, performing hand hygiene afterwards. C. diff is a little different in that it is considered a spore former. And so it's very difficult to kill. C. diff stands for Clostridioides difficile, which is Latin. Difficile meaning it's very difficult to kill. The alcohol-based hand sanitizer does not kill it. And neither does soap and water. So what happens when you perform hand hygiene with soap and water is that it's washed off the surface of your hand and it goes down the drain. And is taken care of by our water treatment system. So for that reason, the sign for these is considered enteric precautions. It's different because it reminds us that we're using soap and water as opposed to gel to perform hand hygiene. But you also want to remember to use the gloves and the gown. Droplet precautions are for infections that have been shown through science to be transmitted through droplet through coughing or sneezing, and heavier droplets that travel 3 to 4 feet in the air. So these are common infections that are spread through droplet. So the flu is a good example of that, meningitis, mumps, pertussis. So droplet precautions just reminds that you have to have a surgical mask to enter these rooms. And this comes into play currently as we're going through this, where everyone enters the facility with a cloth face covering, which is not appropriate for these rooms. So cloth face coverings are not considered PPE and should not be used in any type of room where the patient is experiencing respiratory symptoms. So for these patients, you would want to make sure that you're using a hospital-issued surgical mask and hand hygiene before and after leaving the room. Airborne isolation is used for particles that have been shown to travel through air currents. And these infections, the most commonly thought of is infections like tuberculosis. So patients that have these infections are put into rooms that are designed by facilities to have a negative pressure. So that means that the air in the room is directly ventilated from inside the room to the outside ventilation. And you know these rooms because they'll have a meter on the outside of the room that shows the pressure, which should always be negative if you have a patient in negative isolation. As well as before you go into the room, you should have a respirator, so an N95 mask or equivalent level protection. To wear an N95, you have to be fit tested. And so currently students at United Regional are not fit tested for airborne rooms, so you just make sure that you tell your nurse that you have not been fit tested and you cannot go into airborne isolation. Another thing to remember with airborne isolation is that the rooms to these doors have to be closed or remain shut for the air pressure to remain negative. And this is a sign that shows that it reminds you have to have an N95 or HEPA respirator, as well as that the door is to be kept shut to maintain that negative pressure, as well as hand hygiene. So multi-drug resistant Acinetobacter is an organism that is resistant to multiple classes of antibiotics, and it's been an organism that we've had trouble with in our community before, and so that's why I do education on it. It's associated with long-term care facilities, patients that are chronically vented, as well as it can also spread to patients that have wounds. So it looks like this microscopically, and you can see on the surface of the organism these little projectiles that make it very easy to adhere by contact to something. So it can easily stick to your hands, your gloves, your scrubs. And so it's very important that patients that have this type of infection are put on contact precautions. Environmental infection control is very important in mitigating the spread of infection. And so that's important to know that anything that goes into a patient's room needs to be frequently disinfected before before use with another patient. So that includes any portable diagnostic equipment like your stethoscope, computers, and anything else that goes in and out of patient rooms. And so we have two types of disinfectants that we use. So one is the Prime, which can be used for anything except for C. diff. Remember that that's very difficult to kill. And so for C. diff, we would want to use a bleach-based product. So the orange one is a bleach-based product that we want to use with any patient that has C. diff or as an enteric precautions. For the Prime, you can find what they call the contact time of any disinfectant on the surface of the canister. So if you're using a disinfectant that's not necessarily Prime or this one, you'd look on the label of the product and it will tell you the contact time. So for Prime, for example, that's 60 seconds. So that means that you need to have the surface of whatever you're wiping remain wet for 60 seconds to kill whatever it says on the canister it kills. So Prime kills a large array of organisms, and it takes a total of 60 seconds to kill all of those organisms. And for bleach, it would take 4 minutes to kill everything that's on the label of that canister, including C. diff. So I mentioned cloth face coverings earlier. They're required to enter the facility, and to remind you that they're not PPE and they should not be used in isolation rooms. And that's any isolation room, including contact isolation. You'd want to make sure that you just put your cloth face covering away and use a surgical mask to enter those rooms if you do so. And it cannot be worn in COVID-19 units at all, and that patients should be wearing a cloth face covering at least when interacting with healthcare providers. They can remove that once healthcare providers leave the room, but then when you're entering the room, just ask them to put it on while you're interacting with them. It's very important right now, at the time that we're going through, that we maintain and use social distancing, which means that we try to maintain at least 6 feet between other people as much as possible. Sometimes that's difficult when you're in a working environment, but that if you can, to maintain 6 feet between yourself and others. So I thank you, and I'm welcome you to United Regional. Hope that you have a good experience here, and for any questions or concerns, please feel free to reach out.